Call the Rogers TV viewer response line, email us, or connect with us on social media.
Shaggy and Scooby were taken?
Yeah. This blue light came down from the sky and beamed them up.
Maybe this can lead us to our culprit. Jinkies!
This isn't about some guy in a rubber mask.
I would have gotten away with this if it weren't for you meddling.
This is about one of us.
This is Rogers TV, Grey County.
Hello and welcome to this special edition of Rogers TV dedicated to COVID-19 and our community resources and services available to you. My name is Carol Merton, and before I welcome our guest to the program today, for those of you who watch the program regularly, you know that I like to say a few words of thank you at the very beginning of the program. So I would like to read some excerpts from a letter that was forwarded to me from Francesca Dobbin, who is the Executive Director of United Way, Bruce and Gray. This letter was written by an author by the name of Allison Wines. So I'm going to just read some of the paragraphs and then add a few of my own comments at the very bottom. There is an invisible group of people who aren't being recognized, who are working intensely to keep the world turning, to make sure that those on the front lines have the support that they need, and those at home have something to go back to when we get to the other side of this. Who are you? You're the HR teams working 80-hour weeks to try to make sure we have the workforce in place, planning from scratch, redeploying team members, trying to think of something, anything, to preserve jobs. You're the CEOs of charities, writing new budgets so you can help keep the world with funding that has evaporated overnight. You're accountants and bankers, restructuring finances and debt to help small businesses stay afloat. You're trade managers, negotiating frantically to make sure that hand sanitizers and face masks come into our country. You're consultants, supporting clients through massive change, unsure if you will be paid for the work that you do, but doing it anyway because it matters. You're hospital administrators, running payroll for the nurse that just clocked 30 hours of overtime. You're communicators, trying to find the words to explain a crisis the likes of which has never been seen to your organization, staff, and community. You are not invisible. The message I wish to share back to you is thank you. Your contributions are greatly appreciated, and all of us send the most heartfelt and sincere thank you for all that you are doing. And on that note, I want to also thank Colleen Trask-Seaman, who is joining us today to provide an update on OSHaRE. Thank you so much for coming back on the program, Colleen.
Thank you for having me.
So I'm wondering, for those who may not be as familiar with OSHaRE, if you'd mind explaining your role, where OSHaRE is and the function of OSHaRE, and then take us into an update since we chatted last. It seems like just yesterday, but actually it's been quite a few weeks now.
Yes, so, well, thank you for having me. So I am the Executive Director of OSHaRE, and OSHaRE is the soup kitchen. We're located at 946 3rd Avenue East in downtown Owen Sound. And before COVID-19, we were a meal program in the evenings that served dinner from 5 till 6:30, where anyone from the community who needed a meal could come in and sit down and be served a nice hot meal. We're a safe space for anyone. There's no questions asked. You just come on in and have a meal. But since COVID-19, obviously things have changed. So we now do a meal to go program, still under the same guidelines of that we ask no questions. If you are hungry and need a meal, you can come. We've partnered with Safe and Sound, and we're now offering a lunch program as they were unable to do so during COVID period. So we're open from 11 till 1 every day and 4:30 till 6:30 every day for anyone in the community who needs something to eat. They can just show up, one per household, let us know how many people are in their household, and we will give them pre-packaged either hot or cold, depending on the time of day, meals that are ready to go for them to eat in their house with their families.
So you're not actually having the sit-down meals at this point in time, but actually OSHaRE has really expanded the service that they're doing by preparing meals, and it's Monday to Friday, lunch, and Saturday, and supper as well. So you mentioned that you're providing the meals. How exactly does it work in the COVID world that you're able to, take me through? First of all, how does a person even let you know they need a meal?
So basically, if you are hungry, you just show up at our door. All the meals are prepared in our kitchen. We have volunteers who are still coming in to help us. We've cut back to as few volunteers as possible with our staff. And so we're following all public health guidelines and working very closely with public health. And so we pre-package either a hot or cold meal. Typically, sometimes it's a cold meal at lunch and a hot meal at supper. It just depends. But on those rainy days, we've been doing hot meals for both, because if you're coming out, you want something nice and warm by the time you get home. Yeah. So you just show up at our door. One of our staff, there's a table. There's hand sanitizer outside. You sanitize your hands. You motion to us through a window how many meals you need for your family. We put them on a table, and then we pop open the door so that you don't even have to touch it. You take your bags off the table. It's all prepackaged for you. And then as the door closes, we sanitize the table and we do it all over again. There is no pre-registration. We never know how many people are going to show up. It's kind of, that's how OSHaRE has always worked, but it's definitely added some uniqueness with COVID-19 because we have seen a 300% increase in the number of meals we're doing in a day. So we can serve anywhere from 275 to 350 meals a day right now.
So is lunch the busier time? Is supper the busier time? Or can you really, I know it's hard to predict, but what's the trend been?
The trend has been that supper continues to be the busier meal. Mm-hmm. So typically at lunchtime, we're 120 to 150, and supper, we're always at that 150 to 200 plus mark.
Wow. So before we go into more detail about, how your partnerships work and the fact that you're so connected to the community as well, I want to ask you how the community can help you. There's volunteers, but there's staff and there's food products. And what would be your ask from the community on how we can support you in this venture?
Yeah. Well, the community has been so amazing to come on board. As I said, I actually calculated for you. So since March 1st, without lunch today, because we're currently serving, so I don't have that number, but we've served 14,378 meals.
Since March?
Since March 1st, yes. Wow. And in all of 2019, we served 22,000, just over 22,000. So when you look at those numbers, you realize really how great the need is. And the community has been amazing because we would not have been able to do it without them. Obviously, donations are always welcome. We are still taking food donations, so non-perishable foods, we're coming up to gardening season, so we can definitely take fresh produce because we can wash it and turn it into salads and different things like that. We do have a safe way for you to donate those foods. So you can just come to our office door, which is separate from where we hand out food. And if you push the door open, it makes a bell ring. And then you can just leave the food outside and we can take it from there, so that there's that easy handoff. The other piece is that obviously we have buying power when we can buy in bulk. So any donations to help us to do that obviously help a lot. Our food suppliers have been so amazing. Gordon's Food Service donated 3 full skids of free food to us.
Wow.
Since COVID started, and they've been great to try and give us the most buying power they can. But we've had so many businesses who have dropped off food that they haven't been able to use. We've had farmers who have contacted us who are donating produce and beef and chicken and eggs. And so it has just been amazing to watch this community rally around and make sure that everyone has food.
Yeah. So you still have to buy some products.
Yeah.
So if people wanted to make a donation of dollars, how would they do that?
Yeah.
Since you didn't ask, I'm going to.
So obviously you can donate through our website, so OSHaRE.ca, or we do have a mail slot right outside our door. So if people prefer to donate that way, we have lots of people who just drop a check in there, and we'll make sure you get a tax receipt. All donations are fully 100% tax receivable. So those are the main 2 ways, is either through our website or bringing it into the building. Yeah.
So you mentioned the numbers, and the numbers are staggering to me. Were you surprised?
Yes and no. Obviously, yes, because I didn't expect it to go so high so quickly. But no, in the sense that our community, there are a lot of people in our community who one day had jobs and then the next day did not. And the reality is that rent is high, and people still have to make sure they can pay that, keep roofs over their heads. And so then food is the next, right? And so no, in the sense that we realize that there's a lot of people in our community who just need a little extra help right now. They're people who have never accessed our service before. They just simply are reaching out because this, for the first time in their lives, some of them, they're finding themselves in a place where they need help. And so I'm so thankful that we're able to be there for them and to have a meal for them and their families.
So from your perspective, you are seeing new people, and are they families? Are they, just, what are you seeing? Who's hungry out there? Basically, who's hungry out there?
Yeah, honestly, we're seeing people of all different ages. So we are seeing new families. We're seeing new seniors coming.
Wow.
We're seeing new young people coming. Honestly, there's not like one demographic that we've seen a huge rise in. It's been across the board, and definitely new faces every day. Even this month, we've seen an increase in just our numbers for the time of month where we normally would sit. And they're new people. Like yesterday, I had someone for the first time on a holiday Monday who showed up and said that this was the first time they were accessing our services.
What do you say to people who, come forward but have never had to access, and or those who may be hesitant to access the services? What do you say to them?
I always want OSHaRE to be a safe space where they know that they're welcome, and that you don't need to explain to us. You just need to tell us that you need some food. And that's why we have this service. It's for people who just need it. And I always say to them, they always often will say, well, we used to donate. And I say, that's great. So you helped us to help others, and now we're here to help you. And we have people who show up sometimes, and they'll get a meal and they'll give me a can of tomatoes because it's what they have that they can share with us for us to turn into something else. And so, it's really about just being open and realizing that we're all in this together, and we're all here to take care of each other. That's what our community is about. And so we're so thankful that they just trust us enough to show up at our door.
One of the comments I made earlier was about being connected to community, because OSHaRE is definitely connected to community. One of the privileges hosting this show is that I get to meet the neatest people, and I really get to hear the stories. And it's very gratifying and makes me so proud of the community that we live in. I wonder if you'd share the story, how seniors who aren't able to get down, about who gets the food to the seniors, because I think that's an example of a partnership or a collaboration that pre-COVID, not sure if it would have even happened. So, and any other sort of collaborations that are unique, but are wonderful ways of community reaching out.
Yeah, so that is one awesome thing that I have definitely seen come out of COVID-19 is we always have collaborated, but it's made us take our collaboration to a new level, in the sense that we realize that we all the charities in Owen Sound and community partners, we all have limited resources. We don't want to duplicate services, but we want to work together to make the most out of what we have. And so a couple big things that we've seen is food sharing. So between our organizations, so when big donations, we just had this morning 35 cases of eggs, scrambled eggs donated. And we've already dispersed those to 3 other organizations, and there's more that will be dispersed to. Another collaboration that you're speaking specifically of is that we've partnered with Grey County Housing and United Way and Habitat for Humanity. And so we are preparing meals that Habitat picks up. And this was all put together by the United Way. And so Habitat picks them up, and they take those and deliver them to the people that Grey County Housing has asked us to deliver to. And then there's even collaboration with just our guests, which I really have loved to see. So, a guest will know that their neighbor isn't feeling well, or that their neighbor is elderly and isn't able to make it to OSHaRE. And so they'll come down and they'll just let us know that they'd like to take one for their neighbor who's sick, or for their neighbor who's elderly and it's too far to walk to get there. And so they're collaborating to help us to make sure that everyone is getting fed. And so even the partnership within our guests has been amazing to watch, that they really do want to take care of each other, which is amazing.
Yeah. And we are all a community, and it's a great example of how community links together. So this has gone on a long time, longer than any of us would have wanted to. What do you foresee as far as opening up the dining area? What changes might you make? I'm sure you've thought about that. And do you have any idea at all where you are on the plan for the government to allow the doors to open?
So obviously this is something that we've talked about a lot, and we're trying to figure out, even with our community partners. I mean, Canadian Mental Health has been so amazing. They're baking for us every day to help. So they bake, so that saves us on buying granola bars, and people get fresh baked goods, which is great. So every day they're baking. And so we've all been talking about, like, what does this look like long term? How can we all continue to support each other, but also what does it look like for our programs? For OSHaRE specifically, I have no idea when we will be allowed to open our dining room back up. I think the days of having 100 guests all in at once are going to be a long time, if ever possible again. So we are looking at, eventually how could we try and do some social distancing? Does it look at creating different times for people to stop in for their meal? But how does that work for communication when we want to be that place where you don't have to book an appointment, you can just come and eat? So it is challenging. I think we're a ways off if I had to guess, as none of us have any idea. But because we serve such a large amount of people, I think we're a long ways off from being able to let people into the dining room at this point.
And you raised a really valid point earlier. People are coming because their jobs, they don't have jobs. And whether their jobs are permanently gone or they're laid off waiting, businesses may start to open, but that doesn't mean that people will get their jobs back. So I'm guessing that the need will continue for a while. Would you say?
Yes, definitely. I think that's the biggest thing that we're concerned about, is that even as things start to reopen, there are still going to be people who it's going to take them a while to dig out of what this has brought onto their families. Obviously, if you've had to take out some extra money on a line of credit, all of those things, right, to get you through this period of unemployment and instability. And people just aren't going to be sure. I think that's the reality right now. We're just so unsure of what things are going to look like in the next week, let alone the next month or 6 months. And I think it's going to take us a while before we see that people are back on their feet and in steady employment again, because I think things could, as we've heard, things could shift back, right, depending on how the spread goes and how numbers go and things. So I think we're seeing that a lot with the reopening today. A lot of businesses are opting to stay the safer route and aren't opening their doors yet, and they're sticking with their curbside service. And so that isn't increasing in employment right now. So it is, I think it's going to take us a long time to rebound from this. But as a community, I think we can totally do it.
Yes. One of the advantages of having the dining area where people could come together was about building community for those perhaps who wouldn't necessarily be part of another group. That's potentially a huge loss, I would think. And I'm sure you've been thinking about how to build community around food.
Yes. Yeah, it is a huge loss. I mean, it's something that we definitely hear from our guests daily. And I would say even more so in the last 2 weeks, when they come to the door. And we try and take the time to chat with them while they're picking up their meal and stuff, and see how they're doing and check in on them. But the reality is that they're lonely. They're saying they're having a bad day. When is this going to end? We get that question all the time. When can we come back? When they heard about some of the reopening happening on Tuesday, they thought maybe that meant we were going to open again. And so I was sad to say that we weren't. But yeah, that's the piece that I think is really missing is it's one thing to give people a plate of food. It's another thing to give them the chance to talk and to be heard. And that's the piece that is missing. And so we try our best with our smiles and our chats every day to give them a little bit. But the reality is they're missing it with each other too. And so I hope that we get there soon.
Yes. What you're offering is more than just the physical food. It's that companionship and that collective community gathering. You've served now over 14,000 meals since March the 1st. Yep. Tell me how you and all of the volunteers and the staff are doing this. They must be tired.
Yeah, every day is different. There's definitely moments where we think, but honestly, just the community support has really just helped us to keep our motivation and even just the guests coming, they're so thankful. And so when you hear those thanks and or you hear their quick story about how this is their first time, or even as community partners, we're having Zoom calls and encouraging each other. All of those things have really helped our staff and volunteers to know that we're all in this together, and we have, each day is new, and that we can get through this together. So my staff and volunteers have been amazing, though. We are so thankful. We typically have about 40 people in during the week. They might do multiple shifts, but there's about 40 shifts that we've been covering a week of volunteers, and they've been amazing to keep coming in and to do all that they can. They just want to serve, which is amazing.
Yeah, absolutely. So you're able in your environment to be able to produce the food, but still be able to have the distancing, and you keep your numbers low.
Yes.
So you've been able to do that in your environment, in your new environment.
Yes, that is the key. Honestly, we are just so thankful that we're in our new space. This would not have been possible. 14,000 meals wouldn't have been possible on our old cooking equipment, as well as just the social distancing. Like, we can easily have 5 people in there, and they each have their own counter space. They each have their own sink. And they can stay far away, but you can still kind of chat with each other or yell if the fans are on, because it's loud in there, at each other. But yeah, our new space has meant so much. And even just how the front entrance is set up, it works so well that we have a touchless door. So the guests don't have to touch the door. Like, it all really came together great. Saying we had no idea when we moved that this was going to happen, only 3 months later. So we are sure thankful that we are where we are.
For sure. And who knew, right? All of us are in this whole big new world. When you see someone who comes for food and they identify a need other than food, can you talk a little bit about the no wrong door philosophy?
Yes, very much so. So we are super close with our community partners. We're always reaching out to them. We always have cards on hand and numbers and places they can contact. And so when someone comes to the door, if they have another need, that's what it's all about, is referring to those community partners. I mean, we have people who come to our door who don't have a phone. And so we'll call to make their food bank appointment while they're standing outside our door, so that we can set that up for them. And we have a few guests that do that with us, or I had a guest who came and they really needed shoes. And so I knew that Safe and Sound was open and that they would be able to help. So gave them directions and pointed them down there, and then gave Safe and Sound a heads up that there was someone coming. So that is definitely part of our role, is to work with those community partners, be in touch with what they all provide, and then be able to connect those guests with those services.
And that's absolutely critical, because if people are hungry, then they probably have other needs as well, and having that connection is absolutely critical. Our time is almost up, and I want to express a sincere thank you to you, and of course everyone at OSHaRE, for what you're doing. Also, a thank you to the community who are providing the food and the resources, and I would encourage anyone who wishes to make a donation to do so as well. Keep up the great work. Please come back again and give us an update. I wish I could say you wouldn't need to do that, but it sounds like you might need to provide an update as you provide the service. Colleen, thank you so much for being on the program.
Thank you.
Thank you for joining us as well. Please tune in again to learn more about programs, services, and resources available to you. Take care, stay safe, and care for each other. Thank you.